Greetings to the G20, the T20, and the thinkers and policymakers who provide insights and inputs for important global solutions. I'm Dr. Yonette Thomas, founding board member of the Women's Economic Imperative and associate editor for Women and Girls for the journal Cities and Health. I'm the former chief of epidemiology at the National Institute on Drug Abuse within the U.S. National Institutes of Health, and former vice president for research compliance at the Howard University in Washington, D.C. Whether in the urban sector or rural sectors, women and girls bear a disproportionate burden of global health inequities. Social upheavals, natural disasters, and public health emergencies, such as epidemics, exacerbate and amplify these inequities. COVID-19 bears this flag. Shocks like COVID-19 deepen pre-existing inequalities and amplify vulnerabilities in health, social, political, and economic systems. I would like to take this opportunity to focus in on the impact of COVID-19 on women and girls, especially in the last decade for realizing the 2030 SDGs, and as we process through the current pandemic. Collectively, all of the SDGs impact the lives of women and girls. Specifically, Goal 3, good health and well-being, Goal 5, gender equity, Goal 8, decent work and economic growth, Goal 10, reduced inequalities. These serve as action points for focusing on the health of women as an economic value for the robust development of communities, municipalities, and cities. Women and girls stand at the end of the healthcare queue. Increasing investment in their health is not only the right thing to do, it is critical for stable, productive, and sustainable communities, municipalities, and cities. Valuing the health of women and girls is an investment in our collective future. It is economically sensible. When a woman is healthy, the family is healthy, the community is healthy. Increasing the investment in the health of women and girls produces stable, productive, resilient, and sustainable communities. It is cost efficient. Providing basic health care to women and children prevents illness and disabilities, saving billions of dollars that would otherwise have been spent on medical treatment. In many countries, every dollar spent on family planning saves at least $4 that would have been spent treating complications arising from unplanned pregnancies. According to the United Nations report on the impact of COVID-19 on women and girls, the world's formal economies and the maintenance of daily life are built on the invisible and unpaid labor of women and girls in the caring for children, older family members, and ill family members. Women are doing 3 times as much unpaid work as men. Women predominate in the informal sector and in the service sector, which has been dramatically impacted by the current pandemic. For example, in the United States, women hold 78% of all hospital jobs, 51% of pharmacy jobs, and 51% of all grocery store roles. As frontline responders, women are health professionals representing 70% of the global health workforce. They're caregivers in homes and families, and community volunteers, and much more. Women are making critical contributions to address this outbreak every day and mitigating its devastating impact. Yet, women bear a disproportionate share of the adverse health, social, and economic impacts. Therefore, public health preparedness and response plans should consider both the direct and indirect health impacts of women and girls. And, as the UN recommends, there should be adequate representation of women in response and recovery, planning, and implementation. Public health messaging should target women and girls specifically. The specific needs of women frontline workers must be addressed in terms of their health, psychosocial, and work environment needs. Resources and standard health services for women at all stages of the life course must be evenly and consistently provided. In this last decade for achieving the 2030 SDGs, we can hasten our collective efforts by addressing the gender inequities that exist in health to yield the triple gender dividend for the benefit of us all. As you know, the equation for achieving the triple gender dividend is health plus gender plus economics. Health in terms of quality and accessibility. Gender by recognizing, rewarding, and facilitating the integral role of women in the care economy as health professionals, unpaid caregivers in households, and as underpaid caregivers in the informal sector who lack basic protections. I urge you to establish and strengthen social protection schemes to support vulnerable and disadvantaged populations globally. Women and girls comprise significant portions of vulnerable populations in developed and developing countries. They suffer disproportionately the negative impacts and outcomes related to the lack of adequate social and economic protections. These protections are essential for the economic viability of communities, to assure resilience from the economic and social impacts of this pandemic and future shocks. Recognizing that it is ultimately in the interest of the G20 countries to address and mitigate the risks and impacts of COVID-19 and future shocks, I call on the G20 to take immediate action and demonstrate leadership for the common good and the good for their respective polities. Thank you.